we can continue with 7.1, which is the new locality plans and local improvement plan 2026 to 36. I think the context for this was nicely set by the video we had earlier. This paper is on pages 31 to 32 by way of guidance. There are 4 appendices, and those using accessible versions, these can be found as a second notes attached to your pack. And to that, I invite Ian Robertson to speak to this message.
Thank you, Shane. The IGB has a statutory duty to put in place locality planning arrangements across Aberdeen City. Aberdeen City has 3 locality areas, north, south and central. And since 2021, these have been in line with community planning Aberdeen's locality areas. Locality plans for each of our localities have been in place since 2021 into 2026 with regular refreshes, and now is the time for a suite of new plans. The new locality plan set out how Community Planning Aberdeen and its partners will work with communities over the next 10 years to improve outcomes and reduce inequalities. Developed alongside the new local outcome improvement plan, the locality plans translate our shared citywide ambitions into meaningful action at neighbourhood level. The plans reflect extensive engagement over 16 months with local people, partners and stakeholders, ensuring priorities are grounded in lived experience as well as local data and evidence. Most importantly, all items within locality plans originated from a community idea or reflects a community priority. At their core, the locality plans focus on tackling inequalities and the wider factors that shape people's lives, including income, employment, lifelong learning, access to green space and services, recognising that these are absolutely essential to improving health and well-being. By aligning resources around shared local priorities, the plans provide a clear framework for coordinated partnership-led delivery across our 3 localities, with the aim to facilitating a shared and accountable approach to an early intervention in our communities in order to reduce inequalities and make visible and sustained improvements over the next 10 years. Happy to take any questions, Jim.
Thanks, Ian. Are there any questions or comments?
Yeah, thanks again, and again, thanks for the paper. A question, I guess, around about how we as an IGB can interact and work with the locality plans. So I just wondered if anybody had a comment in terms of giving an example or describing how we as an IGB engage with the delivery of locality plans and how those plans themselves support our own priorities. So just that connection between the two parts, if you like.
Absolutely. So the strategic alignment is clearly there. So thinking about the shift towards prevention and early intervention, that's a key one. And making best use of people and resource and assets. Again, that's linked with our financial sustainability aim as well. In terms of the IGB's role, obviously we are key partners in the Community Planning Aberdeen partnership. One of the system changes, the 5 system changes, is dedicated towards health and social care and preventing death. So there's a core factor in there. And something that the public health would really strong in terms of the social determinants of health, 5 social determinants of that cut across and underpin the local outcome improvement plan and the new LOI. So that influence shaping the strategic direction and the priorities of the new locality plans is clearly there. You can see it within each of the 3 locality plans where the IGB, the Health Social Care Partnership, and its commission partners and community partners play key roles. Simon's just presented on the Alcohol and Drugs Partnership annual report. There's connections with the ongoing work in terms of the harm reduction network, but as I say, the social determinants of health is wider than just health and social care. So hopefully you can see that throughout the items in the course of the plans.
Thank you.
Thank you.
Sorry, yes.
Yeah, thanks. Yeah, thank you. Just a kind of question on in terms of community engagement, local engagement.
Yeah.
If you look at South, for example, we've got places like Seafield, hills, but we've also got Torry. I just wonder the extent to which there may be a difference between some of those areas. Because what I'm thinking, when we do consultations, you get the West End is the one that always, you get a zillion people responding.
Yeah.
And some other areas, you get a few people responding. I just wonder what the differences were and what you can do about those differences.
So I think this is how a good thing about how community planning Aberdeen has set up locality planning arrangements is that we've got our locality engagement groups. We look at the wider localities, and then you've got our priority neighbourhood partnerships that look at our areas of deprivation and priority neighbourhood. So in the south, that would be Torry and Concord. So we have dedicated engagement sessions because we recognise the needs and the issues in Torry and Concord are markedly different from, especially in the south, to somewhere like Hazelhead or Cooter. And I suppose it aligns with the proportionate universal support approach that we're adopting. So provision of basic services for everyone, but that targeted focus where the need is greater and make the best use of the resources where people need a bit extra help, ultimately to tackle inequalities and then close that gap. So that's very much embedded within the locality plans and you know, hopefully you can see that. But this is a long-term plan over 10 years, so it's going to take a bit of time. But the focus and resources are there in terms of priority need neighbourhoods, recognising that they are different.
Thanks for that. We should know that already. That's here. Thank you.
Yeah, just something I've noticed, and just a very minor point on page 269. Under the community partners column, there's Concord Community Council, which we called Community Centre, because further down you've got Concord and Leggett Community Council, which is the correct name. So it's just a very minor observation on my part, but it's my patch as a councillor for to be out at the highlighter. Thank you.
Yeah, thanks very much. We've tried our best. It's not we're not to try to get this right, but we always find something. So I appreciate that. And before we upload it to the website, we'll make that change.
Ask the question if I may, and perhaps this is a silly question, because the services that we provide as an IJB, we can obviously set a geographical boundary for to postcode where people live. But in terms of the broader aspects that make up the law, particularly the determinant side of things, create healthy living, healthy conditions, inclusive conditions. Some of those will be used by people within Aberdeen City, but also people crossing the boundary between the Shire, thinking Cove, for example, will come in. And to draw a parallel example, people living in south Scotland in Frisia will have to access services from the North of England. Now, obviously, these loops are developed as per the region. But I'm just curious in the background, do we have any discussions at any level with the Shire, given the base around Aberdeen City, just in terms of that demand for cross-border services for a better route? Or is that not relevant?
I think I can ask from a locality, like very local, and maybe someone more senior than myself, I can wait for the broader discussions. You're absolutely right in the way that Aberdeen City, and especially a local housing market in Aberdeenshire, we know there's joint schooling arrangements. So think about pupils from Newmarket going to Dice Academy. So that's in place. We know how close Kingswells is to West Hill, and you mentioned about Cove and Portleath. So it's very much the geographic nature of the city. We know we have to collaborate with Shire colleagues, and we do that as a matter of course.
So the states come in to build on you, so I think you did very well. So thank you for that. I think so. There is also endless conversations with our chief officers across the region. That's what we try and do, work collectively and share requirement. There's obviously, as you mentioned there, there's an umbrella behind people that live in Aberdeenshire that use our primary care services. So we're very aware of that, and there is some resource transfer that
I think what we do from our local income improvement plans, it's not, it's a very focused on a city. But again, if you actually look at them across the area, there's definite themes and trends that are within our city, shower money, right, about our local income improvement plan, our saying and doing our aiming to achieve. I think there's that, you know, we all see each other's, but we don't work completely jointly on them because we are those outcomes for our city.
Yeah, there's a comment from Phil in the chat. Could you just?
Kenneth has said that Ian is correct to suggest the involvement of public health. Provide guidance on the social determinants of health, particularly the interventions that have an base for improving public outcomes. Both Carl and Ian really involved me healthy planning to support and advise the local health improvement group. I can provide links into the NHS granting public health.
Like the Callum that he's referenced is Callum Lees, who's my colleague as the program manager for all the executives.
And thanks both for that. We appreciate it. Very helpful. Okay, so the recommendations for this are on page 232 and Emma, I'd like you to take us through those.
It is recommended that the integration joint board note that new housing plan are alongside the new 10-year local income improvement plan during 2025-26. And collaborative way for these unit members and their local permit groups and priority and legal partnerships. Note the community planning Aberdeen board approved the housing plans north, south and central 2026 to 36. New local outcome improvement plan on the 11th of June 2026. Consider and endorse the locality plans north, south and central 26 appendices 1, 2, and 3. Note the steps as detailed at section 4 and request the Aberdeen City Health and Social Partnership and community partners promote the new locality plan 26. Their organizations and search reports to the best audit September 2027 and the performance.
Happy to agree those. Yeah, we are. Thank you. I turned item 9.1, which is the future things. And I'm proposing to put it on a single question. All of the items the same member objects. No member objects, therefore the question is that we have our insight session scheduled for the 14th of July, the 11th of August, 1st of September. Next meeting of the integration joint board on the 29th of September. Are we happy to agree? Yeah, we are actually. That remains for me to begin to wind up the public part of today's meeting. But I must thanking all of you for your patience, very much appreciated to the report authors for pulling the reports together and all of the groundwork that goes into that. Always, I would be very grateful if you could take the time to thank your frontline teams across the partnership. They may happen. We realise it doesn't happen by itself. You have a very challenging to get through this year. That is very welcome. Also, like to put my thanks to Emma for keeping me on the straight and narrow and for our assistance. Always, and as well, seeing all of you at the next public IGB on the 29th of September, if not on screen. Thank you.